Hi, this is almost everything you'll need to know about the posterior axio-appendicular muscles, or the posterior muscles of the shoulder girdle. There are 4 muscles in this group, and there's a table in your book which summarizes them. Table 6.4 perhaps. So the 4 muscles are in 2 groups themselves. There's a superficial group, which is trapezius and latissimus dorsi, and a deep group, which is Levator scapulae, and the rhomboid muscles, rhomboid minor and major, essentially the same muscle with an interval between them, so they're considered together. So starting with the deep muscles, we'll consider Levator scapulae first. It arises from the first 4 transverse processes of the cervical vertebrae and extends down to the superior angle of the scapula. Its action is to elevate the scapula, hence its name, but by pulling on the superior angle and considering the weight of the upper limb from the lateral angle, elevation of the superior angle tends to twist the scapula so that the lateral angle actually moves downwards. Looking next at the rhomboideus muscles, these are rhomboideus major and minor. They're essentially the same muscle but with an interval that divides them irregularly into rhomboideus minor, which is the smaller but superior of the two, and rhomboideus major, which is the larger but inferior of the two. If you remember the key fact that the scapula is roughly in line with the 2nd to 7th thoracic vertebrae, or the spinous processes of those vertebrae, then the rhomboideus muscles' proximal attachment or origin is 2 vertebral levels above that of the scapula. So the scapula is at T2, so 2 levels above is spinous process of C7 and T1 for rhomboideus minor, and then an interval, but from the spinous processes of adjacent vertebra, so T2 to T5. And from their proximal attachments, the fibers stretch down to the anterior surface of the medial border or vertebral border of the scapula. The action of the rhomboideus muscles is to pull the scapula towards the midline or towards the vertebrae, and that action is retraction of the scapula, as opposed to protraction, which is movement of the scapula in the anterior and lateral direction. Next is the latissimus dorsi. Latissimus means broadest and dorsi means back, so the broadest muscle of the back. This is indeed a huge muscle. Its origin or proximal attachment is from the 7th to 12th thoracic vertebrae spinous processes, from here, and then to the thoracolumbar fascia, which is an aponeurosis between the spinous processes, the lower of the lumbar vertebrae, and the iliac crest, and then from the iliac crest itself, and also some attachment to the lower few ribs. From this proximal attachment, the muscle sweeps up towards the upper limb and attaches to the floor of the intertubercular groove of the humerus. So by attaching here, the latissimus dorsi becomes a very powerful mover of the arm. So its primary function is not stabilization, but more to provide strong and wide-ranging movement. And that movement is very powerful adduction, or moving the upper limb back towards the body or trunk. And this is obviously a very important movement in quadrupeds who use it to run, but in primates and humans, it's more of a climbing muscle. So rather than moving the arm towards the trunk, it's more used in moving the trunk towards the arm when the arm has stretched out in a climbing activity. Finally, we have the most superficial muscle, again another very large muscle, which is the trapezius. Its origin is from the occipital bone, not shown here. There's a bit of poor planning in this video. The nuchal ligament, which is a ligament that arises from the spinous processes of the cervical vertebrae, then from the C7 vertebrae all the way down to the T12 vertebrae spinous processes. So in the midline. And from this very broad origin, muscle fibers sweep down and across and up to a attachment on the combined spine of the scapula and clavicle, which is in a horseshoe shape on the internal surface of that construct in a fashion something like this. So the fibers cover Levator scapulae and the rhomboids, and part of the origin of latissimus dorsi as well. And with its neighbour, the trapezius forms a kite-shaped trapezium on the posterior thorax, hence the name. And its actions are varied depending on which fibers are mostly being used and which other muscles are contributing. We test it clinically by having the patient shrug or elevate their shoulder using the upper fibers. Using more of the fibers, retraction of the scapula occurs, and those are the two main actions of trapezius. We'll just briefly review the four posterior axio-appendicular muscles using this very nice diagram. This, for example, also features a skull and an arm, so that's illuminating. So we can see the full trapezius muscle here. Very pretty. And it might save us some brain cells later on to note that the distal attachment of trapezius is roughly the same as the proximal attachment of the deltoid muscle. We see here also the broad latissimus dorsi muscle sweeping up to its attachment on the humerus, and we can also see this triangular area here between the lateral part of trapezius and the superior border of latissimus dorsi, that when the scapula is protracted around by bringing the upper limb forward, the medial border of the scapula moves to here, and in this triangle we can place a stethoscope and listen to the lung sounds relatively unmuffled by the muscles and bones of the shoulder girdle. So that's known as the triangle of auscultation, so superior border of latissimus dorsi, lateral border of trapezius, and medial border of the scapula, once it's protracted out of the way, becomes the triangle of auscultation. Looking at the deeper muscles now, with trapezius and latissimus dorsi mostly cut away, we can see the rhomboideus minor here and rhomboideus major. Relatively little interval between the two in this diagram, which is how it sometimes is in real life. And here, Levator scapulae. So that's just about everything you need to know about the posterior axio-appendicular muscles. Next time we'll talk about the anterior axio-appendicular muscles, another group of 4 muscles. We'll talk about the nerve supply of all of these muscles together in a video on the brachial plexus, so don't have to worry about that until then. I hope you found this video informative, and until the next video, enjoy the rest of your day.